When you're ready to do your blood test, you want to make sure that your needed items are all ready. You want to have your test cassette tore open. You want to place your cassette on the table. You want to have your gauze, your alcohol pad, your Band-Aid, your lancet, and your 2 capillary tubes. When looking at your patient's fingers, you want to check all 3. Some people have colder hands than others. I squeeze all 3 of them. I'm looking for the one that discolors the most, the fastest. And so I have a choice between this finger and this finger. Since he's wearing a ring, I'm going to choose the middle finger. Be careful when you're using, or when someone has a ring on, that when you're squeezing, you're not causing undue pain on their finger. So I'm going to choose this finger here. Be careful not to stroke the finger. As you're trying to get blood down to the area, you'll get a false reading, some extra skin tissue and cells in your blood sample, and I'll give you a false reading. So you just want to apply constant pressure, make sure that the finger's ready to go, and I see that one's ready. So what I do is I always prep 2 lancets in case you get an air bubble. I'm going to try and create an air bubble so you can see what we do in that case. So I'm going to take the alcohol pad. I want to clean the area thoroughly, go and clear around the finger nicely. Don't touch it again. Wait for it to dry. You don't want any of the alcohol to show up into the blood sample, but you'll see that it dries very, very quickly. When you're using the lancet, you want to make sure that the cap is left on it until you're ready to use it. It gives confidence to the patient that it's never been used before. They'll see you removing the cap. This is a one-shot plunger. You push it firmly against the skin on a flat surface. You want to have this be completely flat, and it just is a jab from the needle that will cause the blood to be drawn. On the finger, there's more nerves at the tip and the pad of the finger, and so to lessen the pain to the patient, I like going slightly to the right or to the left. So I squeeze it again. I'm ready with my lancets, and I push it firmly, and I allow blood to flow a little bit before I start to use the sample. And now I'm going to cause a little air bubble here, if I can create one. You usually get those by not having it at the right angle, so I'm going to try and get one there. It's not happening. So just have your plunger ready. You'll see that once I've got the blood, you apply the gauze, ask the patient to hold that on there. You want to be careful when you're taking a blood sample not to scrape the skin cells. If you need to lift it up and place it back down, lift it directly off the skin, place it back down to the blood source, not against skin cells, because you'll get a false reading. You take the cassette. If you look closely, you'll see that there's a reservoir for the blood to go, a finger's pointing to it, and you'll see the white gauze. Apply the plunger directly at the base of the gauze. Do not place it here, because you may run out of blood for the sample. There's reagents in this white gauze, and it's good to hold for up to 30 minutes if it doesn't dry out. You'll see here, let me place this a little bit more, that as soon as you start pushing on the black plunger, that the blood is absorbed. It's mixing with the reagents to not allow it to dry in the time that it takes for it to be run through the machine. You just push it in, and your sample is drawn. Place this firm in the bag that the cassette came out of. Place it along the black ridge, and you'll put your lancet in there. Don't seal it yet, because when you're done with your cassette, you'll take the cassette out, place it in there, and if you remember to always place your lancet linear along the black line, when you grab it and squeeze it like this, you will not risk puncturing your hand with the plunger. Then you take your glove, pull it off to the end, do it again on the other hand, and now you have your sample all secured. It is not required by law to have those in has boxes or blood kits for removal. However, if you have one in your office, it's always a good idea to go ahead and use them anyway. And that's how you perform the blood cassette test.